Before patients reach a final decision about whether or not they would like to proceed with cryotherapy as a salvage option for treatment after prostate cancer has recurred, it is very important that they understand the risks and benefits. From a benefit perspective, they do need to understand that even if their cancer has recurred, there are significant numbers of patients who can still be cured, who can still have survival with disease-free outcomes 10 years or longer after cryotherapy as a salvage treatment option. From a risk perspective, they do need to understand that they do have greater risk of potential side effects than patients who have never been treated with radiation therapy. Radiation therapy does induce some changes in the prostate and the surrounding structures that changes the anatomy in such a way that cryotherapy does have a greater potential for risk. The risks that are sometimes associated with cryotherapy, including those of incontinence and injury to the rectum or injury to the bladder, are typically extremely rare for primary treatment. But in the setting of cryoablation, those risks are increased, but not to the degree that the procedure would be contraindicated. The risks associated with cryotherapy for treatment in the salvage setting are much less and much less severity when they do occur as opposed to surgery. It is also important for patients to remember that in the salvage scenario that sometimes additional treatments may ultimately be necessary. Cryotherapy may not be the only treatment that they need to have to try to get the optimal outcome, but cryotherapy does not in any way prevent the ability to use hormone therapy or other treatment modalities that could be necessary in the future if cryotherapy was not completely curative.